assessment. Well, to give us his reaction, Niall Dickson is from the NHS Confederation, which represents people and organisations who provide services to the health service. Thank you very much for your time this morning on this, Neil. We're hearing a lot about integration of services. Practically, how does that look across the NHS? What sort of things are we seeing?
Well, a lot of what we're seeing has been well illustrated by your reports on the BBC over the last few days, which demonstrate a system that is under enormous pressure, unprecedented pressure, and is coping with under fewer staff than it should have, and with a lack of resources. And I think that that is part of the background that you have to take into account. But I think there's also a recognition across the NHS that simply putting more money in, which is necessary but not sufficient, and that the system itself needs to be reformed. But that will take a bit of time, and I think one has to have a degree of patience here. Reorganising services, trying to get health, social care, GP services more aligned with each other, working more closely together, will take time. And there are further experiments which have been put in place following the Better Care Fund, which one would hope over the next couple of years will start to see results. But what one shouldn't do is say this is the solution to all the NHS or social care problems, and social care in particular absolutely needs more money, and it needs that money urgently.
So specifically, Neil, on that Better Care Fund, you think that it may well be more of a success a few years down the line, but at the moment, like many things within the NHS, as we discuss regularly on this programme, it's struggling to work within the system.
Well, I think you are seeing examples where, for example, the number of admissions of older people into hospital have been reduced. You are seeing examples of hospitals who are managing to get older people out into care homes. You're seeing work, for example, with care homes. It's to try and train the staff there to manage older people without referring them into hospital. But these initiatives do take time, and I think the big question for the NHS is, once we are able to identify success, are we able to roll that out across the system? And that will be a big task, I think, over the next few years. But I hope that both politicians and the public will recognise that this is being set against unprecedented demand. The system is struggling at the moment to cope, and that some patience is required as well as some extra resource.
OK, so some successes in some areas, integration working in some places. We can talk a lot, can't we, about funding streams, about issues that we always discuss with the NHS, but I wondered if you could give us an insight this morning. People watching this at home, what will this actually mean to those who are watching?
Well, I think if you take an elderly woman who has, for example, 2 or 3 long-term conditions. She may have diabetes, she may have had a cancer diagnosis, and she may be a bit frail on her feet. That is not something that the NHS was traditionally to manage. It was really about dealing with episodes of illness, and when people became ill, there was a treatment, and then that was dealt with. Now we're dealing with large numbers of people who are living with these long-term conditions. How we manage them more effectively in the community. So to answer your question, life for her will be different. She may well have a different kind of care worker who will be supporting and helping her to stay at home and manage. She hopefully will have some interaction with voluntary organisations, whether it's Macmillan or Diabetes UK, again, who will be helping to support her and to keep her as healthy as possible within her own home, rather than having a system at the moment where the chances are 3 or 4 times, perhaps in a year, she may well be referred into hospital where they kind of patch her up and then try and send her back into a system, and then there isn't the care at home to look after her. She gets then stuck in a hospital. None of that is good for that elderly patient, and it's certainly not good for the system. So we have to find better ways of making the system work more effectively together. And I think there's a recognition across health and social care in practices, GP practices, community services and hospitals, that